The disease of Chagas and the pacemaker.
Conversation between Evelyn and Bernardo. Do you know who can help me with my heart? Why? Does it hurt? Yes, it hurts, and I don't know what to take. What are your symptoms? Tiredness, dizziness, headaches, but I feel that someone has cast a spell on me. Brujeria. Or maybe it's the age, but I'm not that old. What you need is information about your sickness. I've gone to my healer, and he is treating me. No, Bernardo, the doctor has to give you the information, but I can help you now and talk about it. What is that information? To start, do you know about el mal de Chagas? I don't have too much information. I've not heard good things about Chagas. Heard it's transmitted by la lechuga. More or less, it's like that, but I can explain more. I'm not a doctor, but I'm familiar with el mal de Chagas. I can explain to you how it's transmitted and what the symptoms are, because everyone needs to know this. It is a sickness that affects all of our families and our animals. Here is some information that I obtained from the hospital with reference to el mal de Chagas. You can read up on it. I'm sorry, but I'm a bit embarrassed to tell you that I cannot read. I don't know if you can read it to me so that I can understand. Sure, with pleasure. Chagas disease is a parasite that is found in the blood. It is transmitted by the bite of an animal called avenchuca. The Chagas parasite does not cause a problem in all people, although 3 out of 10 people that have Chagas can have heart problems or digestive problems. How can you find out if a person has mal de Chagas? Normally, the heartbeat contracts when an electric current passes by, which is natural. Having an EKG, the doctor can see how the heart is functioning. To get an EKG, you have to go to the hospital where the doctors can check the current of the heart. First, you have to go to the Camiri hospital to have an X-ray where the doctor can see the size of the heart. It is very important to have an EKG and an X-ray so that the doctors can analyze if the heart is having a problem before the person shows any symptoms.
Porque con los dos el doctor puede ver si el corazón tiene problemas antes de que las personas tengan síntomas.
What are the symptoms or problems of the heart caused by Chagas? Fatigue, loss of consciousness, tiredness, heart palpitations, and chest pains. If you have any of these symptoms, you need to see a doctor at any of the hospitals. What is a pacemaker and how does it function? After the EKG is performed and the doctor evaluates the symptoms, the doctor will then decide if there's a solution for your heart. Your heart has a natural motor that beats. The heartbeat sends blood to the brain and to the rest of the body. At times, in persons with the Chagas sickness, the natural beat of the heart is destroyed, and an artificial motor is needed. This artificial motor has a small battery, and it's called a pacemaker. The actual surgery to have a pacemaker put in is very simple, and it only lasts an hour. During surgery, the surgeon will give you anesthesia. The surgeon then makes a small incision above the heart and inserts a small battery.
Esto es un marcapaso. Este es un motor artificial, o sea, no es real, pero esto es el que le ayuda a su corazón. Puede tocarlo.
This small thing will help my heart?
Sí, eso es lo que le
Yes,
ayuda
this will help your
a
heart
que
pump
su
more
corazón
blood.
bombee más sangre.
¿Qué son los riesgos
What
y
are
los
the
beneficios
risks?
de la cirugía del marcapaso?
Como
The
cualquier
risks
cirugía,
after
la
surgery
cirugía del
in mild
marcapaso
cases
tiene riesgos
are being
asociados.
uncomfortable
Los
in the
riesgos son
implant
eficaces
area.
y leves. Por ejemplo, puede sentir molestia en la zona de la implantación del
Severe
generador.
complications
Complicaciones
are less
graves
frequent.
son poco frecuentes. Los
Benefits?
beneficios de
More
esta
energy
cirugía
than before.
es que va a tener
You will
más
no longer
energía
have the
que
symptoms you
antes de
had
la
before.
cirugía.
You can continue with
Ya
a
no
normal
tendrá los
life,
síntomas que tenía
doing the
antes.
activities you
Podrá
used to
continuar
do.
con la vida normal haciendo las actividades que hacía antes de la cirugía.
Interview with Senor Demetrio about his experience receiving the pacemaker. I was afraid, and so was my family. They were afraid that they were going to open my chest, but it was not like that. It was simple, and I feel much better. I'm very happy with you guys suggesting I get surgery. I would probably be dead by now.
Así fácilmente había sido. Algunos me decían, pucha, allá te van a morir, resulta que nada. Así que el día de 11 de abril ya me han puesto ya Marcapaso y así que tengo ahorita por el momento Marcapaso y siento un poco mejor, estoy mejorando ya. Un mes con 9 días estoy con este Marcapaso. Así que
How do I obtain a pacemaker?
Un marcapaso.
Si su doctor cree que necesita un
If the
marcapaso,
doctors
es
think you
más
need
fácil
a
para
pacemaker,
el cirujano
he will
Santa
make the necessary
Cruz.
arrangements
La
in
cirugía
Santa
es en
Cruz.
Santa Cruz.
First, you would get evaluated by the cardiologist.
Para estar evaluado
He will
por el
determine
cirujano
if you
cardíaco.
need any
Él
other
determina
tests.
si o no
If the
necesita
doctor
otro análisis.
decides you do
Si el
need
cirujano
one,
cardíaco
the next
está de
step
acuerdo
is
que
to talk
necesita
with
un
the social
marcapaso,
worker in
el
the
segundo
hospital.
paso es hablar
He
con
will
el
evaluate your
hospital.
economic situation,
Él va a
and then you
evaluar
can
su
return
situación
home.
económica y después puede volver a su hogar.
What is expected on the day of surgery?
Cuando su doctor sabe la
The
fecha
doctor
de la
will
cirugía,
inform
le
you
informa
the day
el
of the
día de su
surgery.
cirugía.
You can then
Y ese
return
día
early
puede
morning to
volver a
Santa
Santa
Cruz
Cruz,
Hospital.
porque
The surgery
necesita
lasts
ir por
1
la
hour.
mañana al hospital de Santa
After you
Cruz.
stay in the hospital for a few days to
Porque la cirugía
recuperate,
dura solo una
you
hora.
can then
Después de la
return home.
cirugía se queda en el hospital por unos días para que se recupere, después puede volver a su hogar.
What occurs after the surgery?
Va a ser aproximadamente un mes para recuperarse en total. Es muy importante que se
It will
cuide la
take
herida.
approximately
Todo
1
lo que
month
necesita
to
hacer es
recuperate
usar
fully.
agua limpio y
It is
cuidar
very
bien la
important
herida
you
y no
take
usar
care of the incision.
agua del atajado,
All you need to do
porque
is to
tiene
use
que
clean
lavar la
water.
herida con agua y
You
jabón
have to wash the
una
incision
vez
with
por
soap and
día.
water once a day.
Entonces, también tapa la herida con
Cover
una
the
gasa
incision
limpia
with
después
gauze
de que
when it
seca. Esto
dries.
es muy
It is
importante
very
para su
important
recuperación
for your
y puede
recuperation.
causar problemas si no
If
lo
you
hace.
don't do this,
Es normal
problems
tener
occur.
dolor después de la cirugía.
It's normal to have pain
10
after
días después de
surgery.
la cirugía, tiene una
10 days
visita
after,
con su
you will
cirujano
visit the
cuando él
surgeon for him
revisa
to
la
check the
herida
incision,
y le quita
and
los
then the
puntos
stitches will be removed.
suturas
A
y
month
están
after
listos.
surgery, you will visit the
Un mes
surgeon
después de la
again.
cirugía, tiene otro
He has a
chequeo con
machine
el
to make sure the
cirujano, que
pacemaker
él
is
usa una
working
máquina
properly.
especial que se llama
Also,
un
3 months
programador
after
para
surgery,
asegurar que el
you will have
marcapaso
another
esté
visit,
funcionando bien.
then another visit
También
6
tiene
months
una
later.
visita 3 meses
Every
después
6
de la
months after
cirugía.
that, you need to have your
Cada 6 meses
pacemaker
después de
checked
la
in Santa
cirugía.
Cruz.
Para
The
cada 6 meses
pacemakers that we
después
use are
tiene
recycled,
que hacerse
and they have a
chequear
lifespan
para
of
revisar el
7 to 10
marcapaso Santa
years.
Cruz.
It is
Los
important that you go
marcapasos que
to
son
all the
usados para
checkups
nosotros
to
son
determine when
dedicados
you
y
will
tienen
need a
una
new
vida
one.
de 7 a
When
10
it is
años.
worn out, it will
Es
be
muy
replaced.
importante que vaya a todos los
Gutierrez
chequeos para que
Municipal
sepamos
will
cuándo
have gotten
necesita un
together the
marcapaso nuevo.
costs of the
Cuando
payment
su
and the
marcapaso se
mobility to
hace
go to
viejo,
Santa
lo
Cruz for the
reemplazamos con un
surgery,
nuevo marcapaso.
as well as for the
El
checkups
municipio
for
de
Gutierrez
Gutiérrez
patients.
ha sido un acuerdo de pagar por su movilidad de ir a Santa Cruz para la cirugía y los chequeos para los pacientes de marcapasos de Gutiérrez.
Then I will have to go to the AT hospital to do the testings required and diagnostics, because what is affecting my heart is not the brujeria or witchcraft, it's the mal de Chagas. We have this belief it's something else, but talking to you and getting the information you are giving me, it is mal de Chagas. I'm going to AT Hospital. Another doubt that I have, do you know someone that has had this surgery? Yes, but you can speak to the doctors, surgeons, and experts. There is another person, Signor Demetrio, that has gone through this surgery already. You can talk to him and he can explain and get you out of your doubts.
Ahí con él puede hablar, puede preguntarle todo lo que te estoy explicando acá y para que él te pueda sacar de tus dudas también. Es don Juan Demetrio de Cañón de Segura.
Thank you. I will do that.
Ese consejo lo voy a tomar, Emily. Gracias.
Bueno, yo primeramente, sin pensar de un momento a otro, llegó por...
I'm glad I met up with the right people so that I could have my surgery, or else I would have been dead by now.
Pelear acá y ella y un amigo que se llama Jimmy Vieca.
El costo real de un marcapaso cardíaco, ustedes lo pueden corroborar.
The cost of a cardiac pacemaker is something you can corroborate with the two enterprises in Santa Cruz, Medtronics and La Sochi. There are different representatives for each. A double camera is $3,600, and the one camera is $2,300, without counting the clinic fees, doctor fees, operating room, internment, and also the doctors that work by the house. There are several organizations, but Harn International charges the least. Usually the surgery costs more than $5,000 per patient. But in collaboration with various charity organizations, the cost to patients with limited income will depend on the pay they bring home. It could cost anywhere from $0 to $400. The surgery includes the pacemaker, new equipment, and hospital stay. There is a program that may be cheaper, and it's about $350.
Ahora con ustedes, ¿no? Se está haciendo un programa un poco más barato, ¿no? Que está saliendo en 350, creo, $350 en implantes de un marcapaso a pacientes, pero de escasos recursos.
Interview with Freddie Sosa, cruzy patient.
Bueno, mi nombre es Freddy Sosa. He sido viviente de la comunidad.
Since they work very hard in the hot fields, it makes it very hard for them when they have this disease. It interferes with their work routine, and they can't be their best in the fields. It also increases the chances of making the disease worse. We had to explain to them using pictures that we were not going to cut open their chest like they thought, that we were just going to make a small incision in the corresponding spot. This way, they had a better understanding of the operation procedure. Their biggest difficulty and fear was that they thought their chest was getting cut open to have the pacemaker inserted in the cavity of the heart. It is helpful that this video is sponsored by KFWH and produced by Emily Wharton, explaining the treatment process for late-stage Chagas disease will help to eliminate the fears of surgery with educational understanding for patients who are fortunate enough to receive this potentially life-saving opportunity.